Okay.
All right, great. Well, thank you very much, everybody, for coming out again. I think a number of you I've spoken to in the past, so thank you for putting up with us coming back. But this tonight is actually very special for me personally, but also for us as a family, because I purposely wanted to include my awesome, amazing, and very bright, and really the brains behind the organization, behind anything we do at home for sure, my wife Ellen. And Ellen will actually talk about, I think, a very timely area that I know many of you in the audience are very interested in, which is, natural products, herbal medicines, how to deal with androgen deprivation therapy, side effects, and issues around that. So that'll come up in a few moments. And Ellen actually teaches a course at the University of Saskatchewan in natural products and herbal medicines to doctor of pharmacy students. So she's actually immersed in that already, and the prostate stuff is sort of part of it. So when we get to that, I'll let Ellen introduce herself and let her talk about some of the things in there. In fact, the majority of the slides are hers because you've heard my song and dance numerous times. I've never been called, the science Robin Williams before, but hey, that's okay. I'll take it. I think Robin Williams was an amazing comedian. So tonight what we want to talk about is I want to give you a brief update on prostate cancer treatments, the medicinal side of things, what's happening with therapy. Many of you in this room are walking the walk and probably know more about some of the therapies than even I do, because you're living with the disease and you're living with the consequences of the disease as well as the treatments that are forthcoming. And I think Murray has got an outstanding lineup at the symposium later this year of people that are actually timely in this area, and I'll be mentioning some of that. So that'll be the first part of the talk, and then the second part of the talk will be the herbal medicines and natural products aspect that I know a number of you are very interested in, and Ellen will walk you through some of that. And then what we will hope to do is have lots of time for questions and comments and feedback and go from there. So as Murray mentioned, we've been very, very lucky recently for the support group to get funding to do a number of these different things. And so, as many of you in the audience know, we've been now partnered up with the Knights of Columbus out of the Cathedral, and they have provided some support to support the activities of the support group. And in return, they've asked us to come and give talks at the Cathedral to that community about prostate cancer awareness. We did one last October. The timing of it wasn't the greatest. We did it the night that the Blue Jays were in Game 6 of the World Series, but we still had a decent attendance. I couldn't believe it. Of course, I was recording the game, and someone yelled out, "They're winning 3-2." And I'm like, "Don't tell me that." But it was a great event. But they've been so supportive at the Knights and at the Cathedral. Bishop Mark has been very supportive, Father Gerard and the group there, and to the point where they would like us to come back. And so we're doing a second event Monday night, and probably going to talk about some of the same things that we're going to talk about tonight, because there is a lot of men, caregivers, and others, a lot of family members, and I'm happy to see that there's some other people in the audience besides just men representing their families, because anytime you have a disease, cancer, or any type of affliction like that, it is a family matter. It's not just of the person that has the disease. And in some ways, as you all know, sometimes the caregiver, the wife, the kids, the uncles, the aunts, the friends, the other relatives, they suffer as much, even more, than the person that actually is afflicted with the disease. So it's very important to have caregivers come out, people that are supportive of the person who's got the disease, to be there so they can understand the journey as well and help support their loved one through that journey. So Monday night, we're hoping for not only the men that might be facing this type of disease and this type of journey, but also the fact that many of their caregivers will actually come out. One thing I have to mention is my mom told me recently that there may have been some kind of genetic disposition of prostate cancer in my family. My father passed away from cardiovascular disease, but on autopsy it turned out, and this was many, many years ago, back when prostate cancer wasn't really on the radar like it is on today, that, in hindsight, he may have had some prostate issues. So there may be a genetic disposition. So I've obviously got to get tested. But I've got my son, that, and I just visited him in Edmonton a few weeks ago, and I told him, I said, John Paul, you're only 25, but you may want to get tested genetically because you don't know. You don't know. And so we all know that there could be a genetic disposition as part of prostate cancer. So we've got this great support, and we hope to build a community, not only in Saskatoon, but we hope to spread this throughout the province, because I think there are a lot of men in lots of regions of this wonderful province of ours that are really facing, a lot of times alone, the affliction of having prostate cancer, and are afraid and are scared to talk about that they might have that disease. So I think hopefully we're going to be able to do that down the road. I'm going to give you a brief update of something that you guys already all know, but it's important to set the scene for not only some of the new therapies, but also the work that Ellen's going to talk about in a few minutes. So we all know that the signs and symptoms of prostate cancer are things like frequent urination, weak or interrupted flow, sometimes blood in the seminal fluid, the need to strain to empty the bladder, more severely if you've got blood in the urine, pain or burning urination, the urge to urinate frequently at night, and erectile dysfunction. These are kind of the signs and symptoms that you might have the first issues around potentially having something like prostate cancer. And so it's really, really important to focus on three major things. And one thing we should keep in mind, not one test or not one observation is going to be enough to know if you've been diagnosed with prostate cancer. It takes really a number of different factors together that a urologist or an oncologist or somebody is going to look at to determine if you really might be having those first signs of prostate cancer. So, we all know that there's controversy around PSA testing. For some who don't know, that's prostate-specific antigens. Prostate-specific antigen is a protein that is released from prostate cells. But the issue is that we have men that sometimes hypersecrete prostate-specific antigens, and other men that don't secrete it or release it from prostate cells at all. And so therefore, that doesn't necessarily, we know men that have very high PSA levels that have no symptoms and no signs of having prostate cancer. They might have benign prostate hyperplasia, right, BPH, but they don't have prostate cancer. We know other men that have very low levels of PSA that do have prostate cancer. So it's very important that you do a PSA test, but take it in context of within yourself. And the other thing that's important is it's important to establish a baseline for you. So every individual person might have established baseline of PSA. So really what we're saying is that you don't want to just totally rely on PSA as the only test that tells you. You want to look at the symptoms, like I said before, all right, and talk to your physician and your urologist, but as part of a package of understanding if you might be at those beginning stages of prostate cancer, it's important to have the test. By the way, one misnomer that people don't understand or sometimes don't appreciate, once you have been diagnosed with prostate cancer, actually getting PSA tests on a regular basis is actually a very good thing to do, because you know now that that increase in PSA is coming from the fact that you've got some cancer in there. So that's something that you have to be careful of. The other aspect that's really important is a healthy lifestyle and diet. We know now for a fact that if you take fresh fruits, fresh vegetables, things that have got antioxidants in it, and have a healthy diet and a healthy lifestyle, that can help you mitigate some of the issues in the progression of prostate cancer and some of the issues that you have early on. And number three, and this is why I think so highly of the work that Murray and others have done with the support group, this group, support group and engagement. You learn from each other. You learn from each other's experience. You're not alone. And I think you take these three things together, all right? PSA testing, healthy lifestyle and diet, community support and engagement, education, talking to other people who are walking the walk you're walking, talking to health professionals, talking to speakers that when Murray or others bring it in. If you get that full breadth, then you'll get a better understanding of what's going on with your specific disease. And prostate cancer is a funny disease in the sense that if you can catch it early, if you can detect it early. We have great strategies, we have great treatments to help negate it and keep it under control. It's one of the biggest problems is that a lot of men, because they're proud, because they don't want to know, or because they're scared, by the time we determine, the community determines, a urologist determines, or it's determined that you have prostate cancer, it's already progressed farther down the line. And when that happens, the treatments that we have, though they're better than they used to be, make it much more difficult to treat. So early detection, early ideas is the best way to approach this. So this slide is very, very busy, and because it's in this room and it's small text, Ellen warned me, Kish, your text is too small, no one's going to be able to read it. Of course, did I listen to her? No. And of course, is she right? Yes. So, but what I've summarized here, and I've told Murray you can share all the slides with the group or to anybody they want afterwards, is exactly what I've just said verbally. PSA testing, digital rectal exam, consulting your healthcare provider, further testing if you need it, and there's a whole set of resources that you can use in Canadian, just there with the internet and so on, and with great, wonderful websites like the Canadian Cancer Society, the BC Cancer website's excellent. MD Anderson Cancer site where I went to school is a great place. Saskatchewan has a really great website, the Saskatchewan Cancer Agency over here on the USass campus. There's lots of resources. But again, as I said, the three major things to focus on is early detection, being able to have a healthy lifestyle, getting a physical exam, and having that community engagement and understanding where you are with the disease. That is very, very important. Now the big question is, what is the best treatments, medicinally, medical treatments and medical strategies for prostate cancer? So if you've got prostate cancer, once it's been established, how do we want to look at it? And there are really a number of categories here. There is hormone therapy, there's chemotherapy, there's immunotherapy, radiation, surgery, and believe it, in some cases, it's nothing at all. To wait and see what happens with the progression of the disease. Mike Cox gave me this slide. You know, the history of prostate cancer is really quite interesting. As you all know, what is a cancer cell? You know, what is cancer? Cancer is something where, you know, our cells are very well regimented, very well regulated, very well controlled when it grows. But in cancer, the cell grows out of control. All right, it's completely dysregulated. It's going crazy. All the different cycles within a cell are all perturbed and out of control. So that's what cancer is. It doesn't matter if it's prostate cancer or breast cancer or leukemia or pancreatic cancer. That's what cancer is. So when that occurs, the idea is, how do we deal with it? And early on, the belief was simply that when prostate cancer occurred, it was because we were getting a lot of external androgens, testosterone, DTH, and testosterone, that was coming into the cell, being used by that prostate cancer cell so it can grow totally out of control and grow and you know, proliferate and spread. And so the thinking very early on was simply that if we could cut off the pass of androgens, if we can shut it down externally, then the cancer would not grow. And early on, that seemed to be the case. We had androgen pathway inhibitors, very, very good drugs that can kill, that can block and prevent that external androgens from coming in or being developed or being processed in those cells. Okay, we had drugs, enzymes within the cancer cells themselves that were upregulated or out of control, and we have drugs like PPAR inhibitors and taxanes would affect certain parts of the cell cycle that are very, very effective in treating the cancer. So if we could get to the cancer early detection, early treatment, things are looking really, really good. But what happened is that unfortunately, some of this androgen deprivation therapy, ADT, that we have with these androgen pathway inhibitors, the cells got smart and said, you know what, we can still grow even if you inhibit our androgens. So initially, everybody in the field thought that there was an androgen-independent prostate cancer. And it turned out we were wrong. All right? That it wasn't there was androgen-independent prostate cancer. What was happening is the cells themselves said, you know what? No screw on you. Sorry for swearing. All right? We're going to generate our own androgens. And one of the areas of research that we're doing in our lab, Dr. Cox and I at UBC, is looking at cholesterol and how cholesterol is converted to androgens by these cells, all right, in this what we call castration-resistant prostate cancer. Okay? So in fact, what happened was, early on, if you read the literature from the years 2000 to 2003 or 4, you'll see androgen-independent prostate cancer. Turns out all that literature is wrong. It was never independent. It's just that it turned out the cell itself was making its own androgens. One of the pathways is through the work that we do with cholesterol, and I won't go into the cholesterol story tonight, but because I think I've given that talk a few thousand times. But it fooled the whole community, and the community said, okay, if the cell was generating its own androgens, then how do we deal with that? And that's when things got scary. And by the way, the percentages of men, you know, you see the statistics all the time. 1 in 8 men are diagnosed with prostate cancer, right? And that it's the leading cancer in men. I've got to tell you, Murray and I have talked about this even with the foundation, is that I think that number is very underreported, number one. I think it's more like 1 in 4 or 1 in 5. I think it's 20 to 25% of men get prostate cancer. Men are scared to report that they have prostate cancer. They're too proud. They don't know the early signs. They don't have a support group to go to. They have no one to turn to. So even though it's 1 in 8, I think it's actually a much greater number. This castration-resistant prostate cancer, because the cells have decided to make their own androgens, and it may be partly our fault because of the androgen deprivation therapy. We've hit it to block the external androgens. The cell decided to create its own, so we may have caused the problem ourselves. That is even higher. Once you get castration-resistant prostate cancer, that's a 1 in 4, 1 in 3 chance. So things go up. So we have to find strategies around that to make sure that doesn't happen. And then the other problem is that castrated-resistant prostate cancer is a much more aggressive cancer growth than the androgen-dependent prostate cancer. If we can nail it early on and prevent it from converting to castration-resistant prostate cancer, that's good. And that's why some of these other drugs, like the taxanes, for instance, docetaxel, has been around for over 20 years, is still a very excellent drug for many men with early signs of prostate cancer, because the mechanism by which it actually inhibits cancer is independent of the androgens. It mucks up the other machinery within inside the cell, microtubulars. I won't go down into the cell biology of it, but it's a totally different mechanism. To this day, physicians are still using docetaxel a lot because it's actually a really good drug. And actually today, at our journal club, my students were showing me a paper from 2022 talking about the importance of docetaxel in those kinds of patients. The students always make me look smarter than I actually am. So that's something you have to kind of keep in mind. So to this day, we have androgen pathway inhibitors that are still being used. We have these older chemotherapeutic drugs that inhibit or block different other aspects of the cancer cell that are independent of androgens. And we have these PPAR inhibitors that affect enzymatic reactions inside the cancer cell that are also independent of the androgens. So we have 3 different strategies to be able to deal with prostate cancer. However, if it reverts to, and then you can't read the slide. Ellen told me again last night, and I redid it twice, that Kish font's way too small. All right. Don't take a picture and send it to the foundation. We'll just give you the slides. This is the latest in 2025, 2026. And the latest breakthroughs are the following, okay? the number one thing that has happened to deal with this metastatic castration-resistant prostate cancer. So what happened? Am I dinging?
Just continue.
Okay. All right. My son's dinging. Anyway, so there is this metastatic castration-resistant prostate cancer. So when you go to castration-resistant prostate cancer, this cancer where the androgens are being developed by the cells themselves, it grows much faster. And unfortunately, it's this fast growing cells that metastasize, that spreads to other parts of the body, primarily to the bone, and we do not know why it specifically goes to the bone. We think we know. This is some of the new research that's being done in our lab at the Vancouver Prostate Center. And Dr. Cox, I think, is going to come to the support group in May, and he'll tell you the latest and greatest in that aspect of the work. But we need to find treatments to not only deal with this castration-resistant prostate cancer, but more importantly, this cancer that metastasizes and spreads, what we call metastatic castration-resistant prostate cancer, mCRPC. So there are a number of different strategies in 2020-26. This is the latest work that's being done, and these are the major strategies. The number one, and everybody, this has really been one of the game changers in the area medicinally, is the drug called Pluvecto. Now, Pluvecto is a drug that targets radionucleotides, so kind of radiation, to specifically to prostate cancer cells. And the way it does that, it was discovered that prostate cancer cells, unlike prostate-specific antigen that gets released from all prostate cells, cancer and non-cancerous, it was discovered that prostate cancer cells specifically have a membrane protein called prostate-specific membrane antigen, or PSMA. And it turns out that if we can target that specific protein, because that protein specifically goes to just prostate cancer cells, if we can target it, kind of like a drug delivery honing device, we can kill those cells. And the way we do it is we take this PSMA protein, target it to that cell, and then hit it with radiation specifically for just those prostate cancer cells, and it kills those cells and hopefully leaves all the cells around it normally without being hurt. So Pluvecto is a major game changer, right? It was first discovered in 2022 to 2025, came on the market, different provinces. British Columbia, I think, has it now. We definitely have it in Saskatchewan. Several other provinces are now being paid for it. This is a game changer, but it's expensive. And you only want to get to that, you only want to deal with that drug if you're now at that metastatic castration-resistant prostate cancer stage. So there are other strategies as well. There are these PPAR inhibitors. These are drugs that are used to affect the genetic mutations that are inside these cancer cells. So they don't worry about the androgens and all that. They kill the cancer cells by a different mechanism. They're very effective, but you have to be careful how you use them because they can be toxic as well. So you got to find that optimal dose to give to patients. We have immunotherapies. Okay, immunotherapies look at using things called T cells and a mechanism by which we can kill specific prostate tumor cells that are recognized by these T cells. So again, a totally different mechanism. We can use PSMA PET imaging to be able to locate where the prostate cancer cells are and if they're spreading before we target it either with an immune therapy or a PPAR drug or a PSMA drug or a Pluvecto to kill it. And the other great thing is that this advanced imaging has now given our surgeons, our urologists, and our oncologists the ability to know where specifically is the cancer going so that we can do pinpoint surgery. And that's the other area that's happening. And now, with artificial intelligence and robotics, they can do very precise robotic surgeries, or actually using robots with fine metal, with fine instruments to pick out that tumor and resecting just that site without damaging the normal site around it. So it's actually become quite good. The other last thing I would mention is people are using ultrasounds, an ultrasound way to be able to target that particular cancer as well, using an ultrasound approach. So these are the latest strategies that are being used right now. There's a few others at the bottom that are still in experimental clinical trials. There is single beam radiation that is kind of Star Trek, you know, really like bzz, like you know you would see in single beam that's still being used. So these are some of the latest strategies and tools that physicians can have. But I think what you need to take home before I pass it on to Ellen is the latest treatments are the following. Number one, making sure that we know early on if you have prostate cancer or not. Number two, adjusting your lifestyle to making sure that you're eating well, you're eating healthy, and you're exercising, and you're trying to remain in good shape there, losing some weight. Dealing with any cardiovascular issues are really important. Number two. Number three, making sure that you have a community and being engaged with people in your community and support groups like this to learn with other men in the journey that they're going through so that you can see where you are in your stage and then be able to meet with experts as well that are brought into the support group. And number four, and finally, with these suite of different ways to treat the disease, okay, work with your urologist, work with your oncologist, because an oncologist is an expert with some of these drugs that are used not only for prostate cancer, but for other cancers. PPAR inhibitors are actually used specifically more for breast cancer, because the mutations that we see in prostate cancer are also in breast cancer that these inhibitors can be used. So sometimes we bring in not only a urologist, who's a specific person for prostate, they work with an oncologist, a cancer expert who may know about the other drugs that can be supportive. So this is the suite of menu of drugs and strategies that are being used to treat prostate cancer currently, and this is up to date to February of 2026. So with that, what I would like to do now, I'm not going to show you this. I'm going to save this bone stuff for when Mike gets here. What I would like to do now is pass this over to Ellen, and Ellen's going to now. Whoops, sorry. Ellen's going to talk about now some of the herbal medicines for prostate health and prostate cancer, some of the clinical evidence, as well as some of the mechanisms. And I know a number of you have got some questions about some of the pros and cons with what you might see in your local pharmacy and so on. So with that, I'll pass it over to you,
Okay,
Ellen.
good job.
I'll see what my son is texting me about.
It was not an emergency.
Baby's meeting with
Okay, so it's truly an honor to be here today with all of you, and we appreciate your attention. So I am a pharmacy professor at the university. I teach a course in natural health products to pharmacy students. That's what I was saying. I don't think this microphone is.
It's on, but it's not.
Okay, I'll try. I'll try to talk a little louder. I don't think this microphone is.
It's recording.
It's just recording.
Oh, it's for recording. Okay, I will try. Okay, I need one of those big karaoke mics like I have in the classroom. And I'm also a community pharmacist, so I work retail pharmacy, and I get a lot of questions from patients about herbals, about vitamins and minerals and things like that, which is where I developed the course from. And incidentally, I also did my my graduate work through the BC Cancer Agency, where I worked in a department where we developed a lot of new ways to deliver anti-cancer drugs, including docetaxel and other related compounds, which a lot of them actually come from natural health products. So docetaxel and taxanes originally came from a tree bark, and that eventually got worked into a proper chemical. But at any rate, what I would like to do with you folks here today is to maybe just put a highlight on some herbal medicines that you may have heard of that have applications around prostate health, claims around that. I do want to help you understand how natural health products come to be on the market in Canada. Okay, so that's important. It's different from prescription medications. It is not the same process at all, and it's important to understand the differences. And I hope to discuss with you some common ideas and misconceptions around natural health products to be aware of, And then we'll look at a few examples of prostate-related herbals. Okay. So some of the common misconceptions that I hear of quite often are the idea that natural health products that are maybe from plants, they're herbals, they're minerals, what have you, are very safe because they're natural. Okay, that they can't possibly have any toxic effects because they are from nature. This is a very common misconception. Another common one is that because it's a natural health product and it's safe, it can't possibly have any interactions with any prescription medications. Also not true. And I don't need to tell my doctor or my pharmacist about supplements that I'm taking because they are just dietary supplements and they can't possibly interact with my medicines because they're just dietary supplements like you can get at the drugstore. So why would I need to mention that when my pharmacist asks me, what am I taking? Okay. Another one is, well, if they didn't work for what they say, then they wouldn't be allowed to sell them. That's kind of a mixed thing. We'll talk about that. It can't hurt to try it, so why not? Traditional medicines are more gentle than pharmaceutical drugs. Okay. So there are many traditions in various cultures that use traditional ways of treating various diseases. And we're not really talking about that today, but it can get conflated with what we call natural health products that we see on the shelf, which is really what I'm talking about today. How do I go back?
There's a back
Oh,
button.
sorry. I clicked ahead too fast. Okay. And then this whole concept that pharmaceutical companies are just out to make money and maybe I should try to do my own thing. So there is, unfortunately, a bit of an anti-drug company, anti-authority, do your own thing kind of mentality that has grown over the last many decades. So do my own thing first. Okay. Do any of these sound familiar? Yeah?
Yeah.
Okay. So they are pretty, and yet, when you look at the use of herbal medicines, okay, it's like 60% of people in, an age cohort that might be over 60 have at one time or another tried a natural health product. It's extremely common. It's also extremely common in patients with chronic disease like diabetes, like cancer. A very significant portion of those patients will at some point try natural health products. Okay, but there's a lot that they need to understand about it before, casually using such. Okay. Are there any other things that you've heard about or thought about with natural health products, with herbals? Not yet? Okay, we'll come back to that. Okay, we have a little bit of formatting issues. We came over here, but some examples that you may have heard of for prostate health. Curcumin, coenzyme Q10, phytoestrogens, green tea, various kinds of vitamins, so C, D, and E, men's multivitamins, as opposed to women's multivitamins or children's, okay? Medicinal mushrooms, various fruit extracts like saw palmetto, cranberries, pomegranate, walnuts, omega-3 fatty acids, and combinations with lots of things in them. So those are just a few that we'll mention. Okay? So before I launch into that, though, I would like to let you know a little bit about the approvals process for natural health products. You may be well familiar with prescription drugs. You know that after they kind of get an idea in a lab that it seems like a good idea, it's working in cells, maybe in some animal models, they scale it up, they try it in some healthy volunteers, it's not very toxic, they figure out the dosing, they work on how much drug to get a blood level, and then they do it in lots of patients and see if it's working or not and compare it against a gold standard in thousands of patients. And then they may launch the drug and keep monitoring it in tens of thousands of patients and look for rare side effects and so on. So that is the process that would happen with a pharmaceutical drug. For a natural health product, which doesn't have a big claim to cure a serious disease, okay, the requirement for evidence is much less. So it depends if it's just making a statement supports general health, like a men's vitamin, okay? Or if it's saying may prevent something, then they may require a little bit more literature review, a different kind of clinical trial. They'd only be required to produce evidence from a bigger clinical trial in patients if it's saying it's going to cure a serious disease or something like that, okay? Which they almost never put on the label of a herbal product because that would be a very expensive undertaking, okay? So sometimes the language is a little less clear around that. Safety is also another thing. So you have efficacy, is it going to work? And you have safety. So they also have to produce some kind of evidence that it is going to be safe. And whoever's going to manufacture it has to have a site license, which says that they can make it properly in a clean environment and keep track of the analysis of the chemical and so on, that they can, if something goes horribly wrong, they have a way to do a recall. And so those systems are in place in products sold in Canada. Also, there's been a lot of work by Health Canada in the last 10 years to improve the labeling of products in Canada. So it has to say what is the actual active part that is in there. If it's from a plant, it has to say from the leaf or the root of whatever species. And it has to indicate specifically a dose, the duration of action it's okay to take it, and maybe any cautionary statements like keep away from children or not have it if you have serious liver disease, things like that. Okay? So there's a lot of stuff that has to be on the label. Have you ever tried to read a label on a product in the store when you're trying to buy it? Do you have a magnifying glass with you? You need to. Because just because they put it on there doesn't mean you can read it. It's very tiny, tiny little print. So it's on there, but it can be hard to see, and some people may not take the time to look at that to see it's appropriate, or may not be able to interpret it because they may not have the background. So, and then finally, if a herbal company finds a problem with their product, or it's been found that their advertising is not truthful, and Health Canada decides to give them a warning letter and slap a fine on them, might be a few $1,000s. It's not like a drug company being fined millions for something going terribly wrong. Okay? So just some things to keep in mind. It is not as rigorous a process as it is for prescription drugs. All right. But they have to be safe enough in most cases where it's not a requirement that there's so much monitoring by a physician for anything very serious. So there has to be a reasonable amount of safety associated with that. Okay. Now when we talk about cancer specifically, these natural health products are supposed to interact with certain pathways or receptors which will stop that cancer cell from proliferating, from spreading, and so on. So there are many, many mechanisms, just like pharmaceutical drugs, where they could be affecting that process to stop cell proliferation, to encourage cell death. That's still the same idea, okay? Or sometimes to help with more general kind of pathways. All right. Any questions so far? All right. You're saving them up for the end, I'm sure. Yes, Art.
I'm looking at a lot of the advertising. You can't avoid it. On the television, or it's newspaper, particularly. In terms of the natural products, I almost always see laboratory testing. I have never yet seen clinically proven. There's a difference.
Yes, there is a difference. So that's a bit of sneaky wording. So laboratory testing could mean a biochemical test in tubes. It could mean tests against cancer cells. In our case, what we're talking about. So some of these show really good activity against cells in a dish. Okay, but when you get into a whole organism, a whole animal, there's so many other layers of complexity in there that's a much bigger hurdle to overcome. So if it doesn't say the word clinically tested, if it just says laboratory, you can't say that it's been extensively tested in people for what you're necessarily looking for it. Yeah. Okay, let's look at just a few examples and how it relates to prostate cancer. So one that is really, really commonly recommended to men with prostate issues is saw palmetto. So it literally comes from a palm, and you see lots of brands of this. And what it's supposed to do is to inhibit the enzyme, which is important for creating the active form of testosterone. Okay, it's supposed to help reduce prostate enlargement for men who have benign prostatic hypertrophy, which is related to those androgens. And interestingly, it may also help to reduce the androgen receptor expression and some of the other factors around it that help it to work. However, even though that sounds really good, works great in cells, when we actually do larger clinical trials, there have randomized controlled trials. So we put some people in placebo group, we put some people in test group, we mix them up, we don't know who is who, we give them placebo or medication, see who does better, and what comes out in the wash, okay? No significant improvement in urinary symptoms or prostate size versus placebo. Okay. Then they said, well, maybe it's just the dose. Let's bump up the dose. No, that didn't help very much. So it's not really a lot of evidence based on how we think of evidence and the way I described it. We're really comparing it against a control group, proper statistics and so on to say that it is going to help as an anti-cancer agent. You will also see products that have combinations in them. And we understand poorly how combinations will work. And it's very difficult to do a clinical trial with a combination product. Okay. All right, let's look at another example. Hygeum. This comes from the bark of an African plum tree. Okay. So it is literally sometimes the bark from this tree that is powdered and put into capsules. Okay. So if you take a bark from a tree or part of a plant or a fruit and you powderize it and put it in a capsule, you're going to have lots of other things that come along with it, aren't you? All those other compounds that are in there. Okay. Now what if you grow that tree in country A and then some other company grows it in country B, and then this country has a good year, lots of rain, and these guys have a drought, and their soil is good, and their soil has something else in it, you can get a lot of variability in the active components and the other stuff that may be in there as well. So herbals have a lot of variability in those carry-along substances. It can be hard to sort out what is in a given product. So you like to see that it is standardized to something, that it is kind of normalized to something that we're expecting to be active. That kind of thing has to be there. So if it says, it's this one, hard to see, but it says standardized to a certain percent of phytosterols. So Kishore mentioned something about cholesterol metabolism. Okay. So cholesterol metabolism is so important in cancer cells. We mentioned the role of androgen production in cancer cells, and maybe they can do their own thing. The idea, and Kishore will back this up in the future presentation, if we interfere with that process, then maybe that does something. Right, Kishore?
Sounds good to me.
Yeah, okay.
Yes, dear.
Okay, so that's part of the idea, but also it is known to be somewhat anti-inflammatory. It may have an impact on androgen receptor function. It reduces in cells in tissue culture the proliferation of androgen-sensitive prostate cancer cells at high concentrations. Now, if you take some bark from a tree and you grind it up, put it in a capsule, and somebody takes a bunch of capsules, what concentration do you think you can get into the prostate cancer cells in the prostate sometime later? It's kind of hard to get a high concentration at the prostate cancer cell. So that makes it somewhat dubious if you need a high concentration in a controlled environment in your laboratory testing. Getting it to the prostate cancer cells is hard. Okay. That's why at the BC Cancer Agency we spent a lot of effort on drug delivery systems, and that's actually my scientific area. But at any rate, it has been used quite a bit for urinary symptoms for benign prostatic hypertrophy and it can be very helpful, and that may have to do with the beta-acetylsterol component of that. Okay, so some animal studies suggest that it may inhibit some prostate cancer growth, but the randomized clinical trials that have been done with certain extracts have not shown a benefit. So it may be finding the right combination and what have you. Okay. I wanted to click on this link just to highlight something that was brought up about advertising, if I may. So I'm going to step out of here so I can just have a quick look. Do we have web and internet in here?
If there is, I'm not sure it's.
Yeah. Okay, a little slow. Okay, here we go. Oh, somebody was shopping. Okay. Now, we have, when we look at advertising, here this happens to be Amazon. We've got some other things that come up. It may depend on how the algorithms are seeing you, but the advertising that you will see, and this is different when I have the link, but it'll say things like high potency, concentrated. You know, they'll put a bunch of stars by it. They'll tell you can get it cheap if you sign up for Prime. They'll use marketing and words that to drive people to purchase it. So one of the reasons that people sell herbals, they want to help society for sure, but they use a lot of marketing, and we have to be aware of that as conscious consumers, that they're going to use words that will increase your interest in that product. So high potency, standardized, concentrated. I would hope it's concentrated. Otherwise, how would you get a proper dose of anything? Okay? All right, so just be a little wary of that back here. Okay. Green tea. How many of you like green tea? Any matcha drinkers? I can't stand green tea. Okay. But it's supposed to be good for your health, right? I tried for like a year to like green tea. I tried to develop an affinity for green tea because it's supposed to have anti-cancer properties and have antioxidants and be very good for you. And a lot of those things are probably, true. There's lots of good stuff in green tea for general health, antioxidants, and so on. I still can't enjoy green tea. I had to give it all my green tea to a student because I just couldn't take it anymore. But green tea has a lot of important bioactive compounds. So catechins, one called ECGC, those are thought to have this good activity against cancer. So it's got these antioxidant properties, anti-inflammatory, anti-proliferative, pro-apoptotic, which means it helps cells to die appropriately, and so on. There's also some idea that if you look at the epidemiology of people who drink a lot of green tea, some countries they love green tea, others not so much. There's an association between the incidence of prostate cancer. Could there be other things at play? Okay, association is not causation, right? Okay, when they have done clinical trials around green tea, kind of mixed results. It may have a supportive role. It's not a cure. It's not a preventative, but as Kishore was saying, having a diet that has lots of fruits and vegetables and antioxidant, anti-inflammatory properties is probably a very good thing. Okay, I hope you will talk about rank ligand in the future and its role in metastases. Okay, so that is increased by a pro-inflammatory state. Anything pro-inflammatory is not the best for cancer. All right, pomegranate. Typically expensive except around Christmas. But this is another example of an antioxidant, anti-proliferative kind of fruit that contains what are called polyphenols. So flavonoids and polyphenols have these anti-inflammatory and antioxidant effects. Mixed results. Okay, it's hard to do good trials when the products are all over the place. Okay, they've got different components, different strengths. They've standardized to something different. The companies that make these products don't have a ton of money. They're not a big drug company with millions of dollars. Okay, it's very difficult to do a controlled trial with a herbal. So it's been very difficult to sort out whether that's going to have an effect or not. But if you like pomegranate, by all means, have some pomegranate. Okay, it's still going to be part of your fruits and vegetables to help. But it just further illustrates that, that challenge. Curcumin. Okay, does anybody like curry? Curry's not very popular in this group. Okay, he likes curry. That's true. Okay, so curcumin is part of the yellow stuff in curry. If you get curry powder or curcumin itself, it is really very yellow. It is an amazing compound in terms of all the many things that it does related to anti-cancer properties, inhibiting tumor growth, and so on. It may enhance sensitivity to anti-cancer drugs. But one big problem with curcumin, it's really hard for us to absorb it when we take it orally. Like almost nothing gets absorbed. It's a big molecule, it's not very water soluble, and so there's a lot of interest in curcumin and related compounds. But we have to use special pharmaceutical techniques to try to get it absorbed, and all of that has not made it to through to good clinical trials just yet. But there's definitely a lot of interest in using properly formulated curcumin-type compounds as a part of anti-cancer treatment. Okay, it's just a little bit early days, and eating a lot of curry is probably not going to be very helpful. Okay, but it's promising, so we'll see what happens. Stinging nettle. Okay. Unfortunately, we had this in our garden last year. It's hard to get rid of, and it really hurts when you get stuck with stinging nettle. But apparently, there is a traditional use, making it into a tea or a soup. I don't know how they get rid of the barbs, but you know, it is thought to be very helpful for BPH again. It's anti-inflammatory. It's thought to affect androgen availability in prostate tissues. You're going to see stinging nettle in a lot of those combo products. Okay, but we don't know that there's really any evidence to help with prostate cancer prevention or treatment. It might help a little bit in BPH, and then the dose is not very clear. Okay, but you're going to see it in those combination products for sure. Stinging nettle. Lycopene. Beforehand, I got asked about lycopene. So that's the tomato one. Anybody heard about tomatoes? Good to eat tomatoes. You got prostate issues? So that was a really popular concept. Now, a lot of men said, oh, that means I can eat lots of pizza, tomato sauce, lots of spaghetti dinner. Okay, awesome. Well, it does seem to have affect cell growth, maybe some kind of antioxidant effects. They did find that in some small phase 2 trials, this is where the excitement came from, that it may stabilize early PSA levels or BPH. Others didn't show that effect, okay, and those are smaller trials. It's been really difficult, again, to do the larger trials, and meta-analyses have had a hard time grouping those studies because they vary between men eating lots of spaghetti, eat lots of tomato products, how do you standardize that, versus taking a pill, how much do you take, and so on. So that has made it very difficult to sort out. So at this time, it's more like encouraged for prevention. You're going to see it on the list for men's vitamins, and that was partly because of those early promising phase 2 trials. So again, it is not something that is going to necessarily have a dramatic impact. Okay? So not too much pizza. All right, and then finally, this is an example of a combination product. It had 8 botanicals, 8 herbs, and they said it's got anti-cancer activity in patients. Well, then they did some investigation and found that it was adulterated with actual prescription drugs, substances. Contamination with pharmaceutical drugs in herbals can be a problem. Okay, particularly if they are coming from outside of Canada. contamination and adulteration is a problem. So you don't want to be buying stuff off the internet from who knows where or from overseas, because can be a problem. In Canada, they have to demonstrate quality control. I mentioned the site license and so on. Okay? If you've got 8 different herbals in a couple of capsules, how much dose could you have anyway? It'd be a very small amount, right? You know? So dosing becomes a problem when you have something like that. Okay? Toxicity. We do worry about toxicity with any kind of natural products. Typically, it's something like a rash or maybe GI upset. Typically, the herbals are not going to have a large toxic effect. Otherwise, they would not be approved for unsupervised use. But it can happen at a higher dose. We do say that the dose makes the poison. More is not better. So following the dosing guidelines on any product is very, very important. Now, I mentioned a lot about antioxidants. Now, this is a kind of a question that I have that I've not found a satisfactory answer to, in that radiation needs to generate oxygen-free radicals, right? So if you're taking an excessive amount of antioxidants, might you interfere with the activity of radiation therapy? There haven't been any good trials on that I've been able to find. However, they have found that if someone is taking antioxidant vitamins or have a decent amount of antioxidant fruits and vegetables in the diet, it can be helpful for healthy tissues being able to recover and have fewer side effects. So that's a positive thing. So Kishore was mentioning about having a good diet, an anti-inflammatory diet, fruits and vegetables, to help the body to recover from the insult of radiation. So we do understand that, okay? So that's where your spaghetti comes in, lycopene. All right.
Sauce.
Yeah. Remember too that your pharmacist has resources to help you understand drug interactions, which includes with herbals. We have databases that we can use to look up interactions between a herbal you're interested in and your prescription medications, which would include drugs for anything you might be using in the course of cancer therapy. So it is very important to check in with your pharmacist about that before trying something. Okay, that's partly what we're there for. Okay? So we don't know necessarily about co-administration of different herbals is going to have an impact. Often it may just be not enough of an active substance to do anything, or it's a weak activity, but adding extras does not necessarily help. There's a lot we don't understand about looking at those kinds of interactions. There's so many potential compounds out there. It's hard to know. Okay. Any questions so far? Any of these herbals? Have you heard of others? Yes, sir.
I wanted to talk about the placebo effect.
He wants to talk about placebo effect.
Yeah.
Great.
Okay. Now, I've read some clinical trials
Great.
on different drugs, and the one in question that is used, and the one that has the placebo, often the one that is the placebo is almost as effective as the drug you're trying to test. Do you have any comment on that, or why that might be?
Yeah, for sure. So he's asking how come sometimes people respond to a placebo. Okay, so it can depend on what the outcome measurements are. What are we actually measuring? Is it a biochemical marker, which is pretty hard to have a placebo effect, but or is it something that is more qualitative? The placebo effect can just come out through random interactions. Okay, people have maybe you're testing something to see if it affects body weight. Okay, that's something we can all understand, right? Body weight goes up and down. We know we're in a clinical trial and we're on something to help weight loss. So we eat a little healthier to see if or we exercise a little more, and we get these little confounders in there. okay? Which is why blinding is important. You should not know what you're taking. But even then, you know, if people know they're in a trial, it can change behavior. And that's where we can, or they, you know, that belief, that behavioral change can affect. Kishore has a comment in the back.
Actually, this placebo comment question is actually excellent because it depends on the disease state.
Mm-hmm.
So I'm going to say something that might be a little silly, but it actually illustrates the point. How many of you watch MASH? The old MASH shows, okay? Do you remember the episode where they didn't have any pain medication for the troops? And Colonel Potter brought the guys in and said that we're going to give them a placebo and make them, you watched that, like,
It was
you
just
saw that
on.
episode,
It was
yeah.
just on.
And the idea is that if the physician believed it, that the patient would believe that actually that the pain medication that they were getting, which was a placebo, was actually working. Now you might think that was a silly episode and that in real life that doesn't happen. They actually had a medical physician who was actually an expert for the MASH episodes, who actually, he wrote that script because that happened in World War II during an actual situation. So the placebo effect, this builds on Ellen's point, the placebo effect can actually be real for a very short period of time, but it depends on the behavioral belief and the disease that you're talking about. So in the case of pain, there has been some good research showing in short-term pain situations there is an actual placebo effect in some cases. So it really depends on the disease you're dealing with, as well as this fundamental belief. If you believe that the medication that you're taking actually is going to work for that, in this case, the control of pain, because that's something in your brain, right? It actually can have effect. Now, in the case of prostate cancer, that's something a little bit quite different. I don't think you could believe.
No, and besides, when we do clinical trials for cancer medications, it's against the current standard of care. It's never going to be against a placebo. That would be unethical. Yeah. So, if there is a standard of care, that would be the comparison for a significant disease. Okay. I was actually asked also to comment. Oh, yes. Mr. Batista.
You talked about the African plum tree and different conditions.
Yes.
In the case of green tea, is that just green tea leaves? Or there are probably, half a dozen different types of green tea?
Absolutely.
What are you getting when somebody says drink green tea?
Yeah, exactly.
Does it work?
Yeah, well, they're related, but yeah, exactly. I mean, if you think about wine, okay, a lot of you may have had wine before, and you know that they're not all the same. Those are from grapes, and they grow in different places and different conditions, and you get a different product, and it's been processed in various ways. That should be a very clear example by analogy. Yeah. Okay? So that's why it should be standard to that ECGC compound.
Question.
Yes.
Just right out in terms of green tea, it's actually just a younger plant, same tea as the black tea.
Yeah.
But in fact, as with any plant, it's a big difference how it's grown.
Absolutely.
That's why there's less of the organic movement and very strict about methods, because it's very different applying a synthetic or certain things that is in a balanced ecosystem. So the soil is a balanced soil will have more likely to have properties that are understood.
That's right. And you can certainly have herbals that are organically grown and prepared as well. Yes. Absolutely. Yes, sir.
If you watch the internet much, you're constantly bombarded with these cures, herbal or whatever. Is there any law against them putting forth a lie about their product?
So the question is, what are they allowed to do in terms of claims? They do have to be careful about the wording. they can say things like supports the health of whatever organ, or may be useful for the prevention of thus and such. So they use language that kind of skirts around, but you have this implicit association. Oh, it means that it's going to give me a cure or a strong prevention. But they will, if you look carefully, they will use language that
Well, some of them
kind
are
of
pretty
skirts around.
strong, like, for instance, cure for constipation, you know? They're very definite that this thing is.
Well, maybe it works. Yes.
I should have just added that, when a product is organically created, it has to have the stamp on the bottom.
That's right.
Certifying body, and it's important to check certifying body.
Yeah.
For example, in Canada, our regulations are very strict.
That's right.
And that's been a long fight with organic producers. It's been fought against by big corporations because they don't want to have to go through that. So that's where the fight over the term natural, even the word organic, they don't mean it's organic certified. And they're not supposed to use organic on the label. I think actually Health Canada got in on that.
Yep.
Saying it's not supposed to be used. Natural is catch-all, you know?
That's right.
So that, I should have mentioned that as a very important point.
Yeah, it is. And thank you so much for bringing that up. Natural does not mean organic with the proper certification. Absolutely. Thank you. Yes, Kishore.
I asked you a lot of questions.
Good.
Actually,
Keep it coming.
Your comment earlier on, I'd like to address that. So I work with a nutraceutical company. Ellen knows about this company, Forbes Meditech.
With the chocolates?
Yeah, with the
Yeah, I ate too many of those chocolates.
So I work with a nutraceutical company that had developed a plant sterol to reduce LDL cholesterol, like the bad cholesterol, but it was a nutraceutical. It wasn't a medicinal product. And actually, when we marketed it on the market, what you say in the advertising is, we've got preliminary evidence that says this can help lower your cholesterol. That's all you say. And you put it in really small print about this big at the bottom of the ad, right? And we actually had lawyers that would come in and make sure that we were legally allowed to say it. But the language was such that if you were watching a football game and you saw this come on, and you were just 10 seconds, you would think that it was already clinically tested and reproduced, and you had the result. When the reality was, all we said was, we've said that it may help reduce your cholesterol. Look at the words, may help reduce. We're not saying it actually reduces it. It may help reduce.
But the video goes on for another 20 minutes.
That's
Yeah,
right.
you watch the video for 20 minutes and then they want to sell you something at the end. That's right. Yeah, anything with a long video, I'd be
I mean, so
suspicious.
it's a funny business, right? Like, Ellen and I are medical science people that work on pharmaceuticals. It's a very rigorous process. But when I did this nutraceutical product, they were throwing it all out in a totally different world and so on. Ultimately, we actually did a proper phase 2 clinical trial with this plant sterol and saw 11% reduction in LDL cholesterol. But the FDA and Health Canada said that you had to have a minimum of 15% reduction over 3 months for it to be considered a pharmaceutical. So they end up branding it as a nutraceutical and put it in these chocolates, which cause diarrhea, which is another story. got to the market, and I had Ellen used to come to my office and take those chocolates. So.
Only one at a time, though.
Yeah.
I never had any
But your point
GI
is-
issues.
Your point is well taken. Like, what's that beta prostate? Do you see those commercials for that beta prostate product that's always on TV? All right? And if you look at the graph is so out of whack. The y-axis, the one axis, the difference is between 10 and 7. And it looks like it's a 50% reduction,
Yeah.
but it's only reduced from 10 to 7, right? So
Yeah.
these are the tricks that they do
Yeah.
to make you, and then right at the very bottom, it'll say, this has not been approved by the FDA or Health Canada. It's about this small, okay? So this is the kind of things that they do marketing. So you have to be careful about that. So you bring up a really good point.
Yeah.
But they're allowed to do it, market it that way.
It is a much, much lower barrier to entry to market to make money than a lot of other businesses.
So we call them nutraceuticals.
Yeah.
That's the name that you give. Sorry, Ellen, go ahead. This
That's
is
okay.
a very important slide for our colleagues.
Yeah. So I heard that there was interest in a little bit of commentary on natural health products that may help to manage the symptoms of androgen deprivation therapy. So, for example, fatigue can be very common. And there is an idea that taking lots of B vitamins will help with fatigue. There's no evidence that taking B vitamins helps with fatigue unless someone actually has a documented B vitamin deficiency and anemic and all of that. So that's a really common general misconception too, and you see that helps energy, you know. Okay. Osteoporosis. So we know that vitamin D and calcium are important, but on their own, it's not enough. If someone has clinical osteoporosis, they would need prescription drugs for that. So denosumab was mentioned in Kishore's slides, for example. Hot flashes, so for if someone is experiencing hot flashes, the ones that are herbals that are on the market for that are for postmenopausal women. Soy isoflavones, may have some effect. They work as kind of a weak estrogen receptor agonist to promote that body temperature regulation. And some studies suggested maybe it helps PSA a little bit through a hormonal mechanism. Evening primrose is another one marketed for hot flashes. Doesn't help anybody, actually. No evidence for that. Sleep disturbances, we have melatonin, which is a hormone that comes from the pineal gland that normally helps us to fall asleep in the evening when light goes down. So that can be helpful for some people that have trouble falling asleep. Have to check for drug interactions. Really interesting one is muscle loss. Has anybody heard of creatine? Yep. Okay. So creatine helps to store up in the muscle the substances which are important for the muscle to generate energy to do its job. So if someone is taking creatine, it can help them with their resistance training so they can do a better job at it, so they can build more muscle. Just taking creatine with no resistance training does exactly nothing. So it has to go along with actually lifting some weights, doing some exercise, but it has been shown to be helpful for building muscle in older people and in patients who are even quite depleted to the point of sarcopenia, which is a lot of muscle loss.
And
So
actually affects,
creatine is good
and
stuff.
It also affects the fact that it can make faint if you've got kidney disease involved, because creatine gets converted to serum creatinine by an enzyme called creatine kinase, and serum creatinine is a biomarker we use to determine renal function.
Yeah.
And there are men who are on prostate cancer secondary. They have some kidney function issues, and if they take creatine to deal with some of the prostate cancer, sometimes the physician gets fooled because they think that they have a kidney issue, but it's because they've got all this excessive amount of serum creatinine.
Okay.
So you have to be when you speak to your physician, to your urologist or oncologist about the things that you're on, please let them know about all the different herbals or things that you're also on, because that gives them a good full picture of what's happening to you. Because some physician might say, hey, this cancer drug is not really good for you because it's causing kidney dysfunction, but it turns out they may be fooled by that because the fact they're taking something like you're taking creatine at the same time.
Yeah.
Sorry for interrupting.
That's okay.
I think it's important
That's okay.
for this audience.
Yep. Okay. Brain fog and memory issues. So ginseng is popular for something like that. Ginseng has a lot of drug interactions. Okay, there's not really clear evidence that it helps anything with memory. It has a lot of different uses, so you can see it advertised for many different purposes, but it does have a lot of drug interactions. So that would be one to check with your pharmacist on for sure. And then, I'm sorry, I keep clicking this. And then for depression, St. John's wort is basically, it's very similar to a class of drugs we called SSRIs. So it's very similar to Prozac and drugs like that. But it has a lot of side effects and drug interactions. So it is effective, but you would want to be cautious with that one as well. Check with the pharmacist before taking anything. Okay. So, just to wrap it up, sorry it's a little long here, that healthy lifestyle, just to reiterate, antioxidants, so fruits and vegetables, exercise as well, keeping inflammation down, really important. And currently, there have been no herbals that have been shown through clinical trials to cure prostate cancer, unfortunately. They can have side effects, and you should not mix and match them with prescription drugs without proper medical consultation to make sure it would be safe and effective for you. Okay? So that is pretty much where we're going to end. For those that might be receiving slides, I've got some references that are here, and I'm happy to take any other questions for you. Yes, sir.
So where does the vitamin D come from?
Which vitamin? D?
B,
B.
any of them? Did they come from a natural place? Or?
Yeah.